Yep.
Okay, Robert is here today with a multitude of things, but we're going to work the shoulder today. We look like we have a rotator cuff here. We have permission from Robert, correct?
Yes.
To videotape you today. So we did some of the orthopedic testing on Robert to determine that we do have a rotator cuff tear, and so now we're going to go into the treatment. So let me explain that a little bit to you. When we treat the shoulder, it's going to be a little tender, a little painful to you. If we go too hard, you tell me to lighten up or ease up, one of the two. Don't tell me it hurts, which that's okay if you tell me that, to let me know that that's a particular tender area. But if I'm going too hard into the tendon, you tell me to lighten up or ease up, one of the two, right? And I'll do so immediately. Now, we haven't treated this shoulder yet, correct?
That's true.
Okay. And the first initial test that we've done was in abduction and flexion, where we're both weak, and then in extension, where we're both weak, and then internal and external rotation were good on him. Although the tests weren't too painful, we were a little weak, and the most painful test was this one with the thumb down. Is that correct?
Correct.
Okay. So let's do some of the treatment here. And what we'll do, Robert, is it'll take I don't know, 30, 40, 50 seconds to treat you, and then we'll come back and do a retest, and then we might go ahead and treat it again, and then we'll see what we got when we get done. I want you to be able to grade all this again when we get done, percentage of improvement, both pain and strength. Yeah.
Okay.
So let's do this. Let's bring the arm around back here. And just relax that arm right there for me. We're going to follow the tendon right down in here, into the shoulder here. Again, back me off if we go too hard.
Okay.
Then don't forget to breathe here. Just tell me to lighten up, raise up one or two if we go too hard. Okay. How we doing?
Doing well.
And give me about 15 more seconds here, and we'll. That's not where I want to be. So with whatever we do, when we treat it, we want to come back and test it to make sure we've done the right thing on the right spot. Okay, let's take a break here.
Okay.
Get your breath. Okay, so compare this to the first time. Let's have you take the arm out, thumb down. You push up, I push down, see what you got there. Give it to me. What do you feel?
Feels stronger.
Stronger, yeah. Palm up, push up. Okay. What do you feel?
Stronger.
Any pain?
No.
Bring that arm around back and take that hand in towards the spine and resist. Actually, was this the one that was the worst?
Mm-hmm.
Okay. Resist here. You take the hand in towards your spine. Resist.
Okay, it's a little weaker, a little bit of pain flare up here, but
Okay.
not as much by any stretch.
Better
it
than
feels stronger. That's the key
Yeah.
thing.
And I actually had to strain on you to resist that, whereas before I didn't have to do that. It's like, ugh.
Right.
Yeah, it was painful to you.
That was considerably weaker.
So percentage-wise, how much better is that? Let's take that into pain first. Pain category, how much better is that percentage-wise? Honestly, what would you say that is percentage-wise from the first go-around of testing?
Probably between 40 and 60%.
Okay, in pain, and how about strength?
80%.
80%. Is that significant to you?
It is.
Yeah. So again, that's basically what we're looking at. What did I say? Anywhere from 30 to 100% improvement in the first treatment. That's typically what we'll get. Okay. So that's basically it. That's what we'd be doing. Removing the scar tissue, get significant improvement, just like that. So
That's good.
that's it for Robert.